Hi, I was diagnosed with Polycythemia Vera actually in April 2015. I was pregnant at the time, and it was actually kind of interesting. I was referred to the oncologist, hematologist, from my obstetrician. Anyhow, so what happened is she had noticed that there were problems with my blood work. And she said, your blood's looking, kind of rough. It was very thick. It looks like the numbers are really high. This isn't normal. And I said, that is normal though, because I've already gone to a neurologist for quite a while. I've seen other doctors, and my blood has always been really thick, and the numbers are always off, and no one said anything other than, you've had many strokes, you've had this and that. I'll get into that in a minute. But she was really concerned, and she said, you need to see the oncologist. So I went to make an appointment. He was at least, I think it was 3 months out before I could even get to him. But then she told me, next time you come here, if you don't have that appointment, I'm not going to let you leave this doctor without seeing someone. So I went, I saw the doctor, and I said, please get me in. My doctor says I have to do this. I'm pregnant and there's some complications. So I was able to get an appointment. It wasn't super fast, but it was enough. We went in, and he took my blood, took a lot of tests, and came back. And during that time where, they were doing the tests, I wasn't feeling good. I was feeling horrible. I had, I was sick. I didn't know what was wrong with me. I felt like I was going insane. And it wasn't just the pregnancy. Actually, there was things that were going on before. I think the year beforehand, I actually was so thoroughly exhausted. I was calling in sick. And it wasn't a normal exhaustion. It was exhausted and weak and sick. I had headaches where I truly felt that my head was going to explode. I was having these migraines where it was insane. They were so intense. I couldn't see. I had, blurry vision. I'd see blue. I was going blind. I had double vision, which is actually really scary if you've had it. I mean, it's shockingly scary. I had that. I just didn't know what to do. I was dizzy all the time, trying to balance myself, and I'm trying to, put on to everyone, oh, I feel fine, I feel great. But inside, I'd struggle through work. When I went, I actually had called in sick so much during that time. It was really embarrassing. It wasn't normal for me. I loved working. I loved my job. I loved my coworkers, my bosses. I mean, I was really happy, but physically not okay. I did feel like I was going crazy because I didn't know what was wrong. So I went into urgent care one time, and they said, well, for these migraines, you're going to need this medicine. And they didn't do any other tests. I was scared to take the medicine because I had read all the, the literature on what could happen. And I was like, I'm not going to do that. I'm just going to kind of push through them. And then it got really bad, and I thought, I've got to do something else. So I was referred to a neurologist. I went to the neurologist. He got some blood work done. The blood work was screaming that I had PV, Polycythemia Vera, or an MPN, which is Myeloproliferative Neoplasm. Not really great at pronouncing that. There was something. There distinctly was. But my neurologist, instead of following up with this, he wrote on the notes, must be dehydrated, and continued to prescribe me pill after pill. I was sick constantly on these pills, on top of just toppling over, just sick all the time. I was really not doing well. And it got to a point where he thought, well, possibly she has a hole in her heart. Oh, I should backtrack a little. I went in, got an MRI. He couldn't, there was something definitely wrong. It looked like there were, I guess there were mini strokes. He was able to see, some marks on my brain from something, and said it looks like there were mini strokes, but for someone my age, that was not normal. That was not okay. And he didn't know why. Again, he did not refer to the blood, but he thought that maybe I had a hole in my heart. So we went in, and I had a test where you actually lay down and they pump air through and put bubbles in your heart, and they look at that. There was no hole in my heart, luckily, and but it's still, there was no explanation. He just kept changing meds, you know, putting me this and that, and you know, they were making me sick. And so I thought, you know, there has to be something natural, something else I can do. So he had switched insurance at the time, and I couldn't afford to go to him. And I was like, well, that kind of works out for me. And so I took a break. I tried to find some natural medicine. Didn't really work for me. But I had kind of a time where I was feeling okay, like not so intense with the headaches. Oh, one thing, the neurologist actually put me on, I think it was 4 aspirin a day, which surprisingly is really nice, you know. On top of every other medication, but the aspirin was wonderful. So then, feeling good, all of that for a little bit, well, good enough. Got pregnant, feeling terrible again, and not just the pregnancy. We went in, they had to do the test, I don't know what it is, where they stick a needle in your stomach and pull out whatever they've got to do to test something, I don't know. Anyhow, so they did that, but I did not recover. I mean, other women, it seems that they're like, oh, they can go back to work that day, or, you know, the next day, you know, just keep it light. I was not better for a couple weeks. I mean, I was sick, and there was something wrong. So again, we have this test, we have the blood tests. I see the oncologist, he gets the tests, I go back. In the meantime, all of that had happened before. Pregnant, get my testing. My husband and I had been, you know, Googling what is wrong. Now, mind you, we did not look at my old blood tests from the neurologist because he'd written them off, so we kind of did too, you know. And he's like, you know, with all your symptoms and how everything is going, I bet you have this Polycythemia Vera. I'm like, who knows that? And, you know, you have to be an older man for this, and you're kidding, you know, whatever. And we just talked about it. And so, strange enough, my husband had found this, and it's rare, so it's not like it's something just jumping out to, you know, oh, you have this. So when I went in, and my doctor gave me the results, he said, you know, you have Polycythemia Vera. And then he got really serious, and he was trying to explain it to me, you know, this is your bone marrow, it's producing so many more blood cells and all of this, and he was very serious. Mind you, my mind isn't always there, and I'm like, I knew it, and he's like, what? You know, what kind of response is this to tell you that you've got this problem with your bone marrow, and you've got a blood cancer, and you're pregnant, and this is, you know, whatever. But the relief I found from knowing a name that went along with this absolute insanity I had been feeling. I mean, my neurologist banned me from exercise because I'd get so dizzy I'd just fall. And I was sick all the time, and I mean, it gets really embarrassing, and you have no explanation. And so when he told me this, the relief was amazing. And I thought, great, we have a name to it. Let's get a solution, be done, right? I've got a baby to have. I was so excited. I've always wanted a baby. I love my baby. He thought I was nuts, I think, because I was so relieved. But then he's like, okay, let me explain this to you. And I said, wait a minute. Please write it down for my husband, because there's no way I'm going to remember all of this. And, you know, just not there. And that happens. It's part of PV, by the way. So anyhow, he wrote it all down. I brought it home, and I said, honey, you know, I got an explanation. I have PV. And he was like, are you serious? And he was like devastated. And I didn't understand. I said, you know, wait a second here. I thought, you know, we have a name, we got something to do, we can fix this. You know, all this craziness, it's going to be fixed. And he took it really hard, and I didn't take it. I didn't understand. You know, sometimes that's just how it is. So, well, I Googled, instead of how I was going to be, I read it, and it said it's a blood cancer and this and that, and it didn't really sink in. I don't know why. I knew it was grave, but the idea that there was some hope really, you know, I don't know, it just made me feel like, okay, we can do something. So, all I did was look up Polycythemia Vera and pregnancy because, you know, number one, I was pregnant and I always wanted to be a mom and I had a baby to take care of. And I had all these complications, but we needed to have a baby. So, long story, we ended up, well, I saw the, when you look at Polycythemia Vera and pregnancies, it's not the best of outcomes. It's not. It just, you know, what you read is not super happy and exciting and it's like, oh, this is going to be a great time for you. It's pretty serious. You know, you don't have a lot of people going through the entire pregnancy having a baby. It just did not look great. So I went back to my doctor and we were talking about the baby doctor. I can't think of the name right now. Anyhow, she was like, you know, you're going to have to see some specialists because this isn't something we normally deal with when you're pregnant and it's very high risk. So, of course, I don't think I got it the entire time other than I wanted my baby to be okay. So, we went in. It was really rough. I was on Lovenox and aspirin while I was pregnant. So, you know, injections on both sides. I was bedridden pretty much the whole time. Ended up getting diabetes. That's a whole other story for another time, another video about pregnancy, rough. But I did Lovenox and aspirin. I was on bed rest the entire time. I actually was in the hospital for one time for 1 week, and then they let us go. We wanted to go see the Dalai Lama, so they let me out of the hospital, which was, it happenstance. It was wonderful. We went, I had to promise I would do nothing, pretty much. We went, we saw the Dalai Lama because we'd already, you know, got everything for it. And then we came back and I was out of the hospital for a little while. And then I was actually admitted again. I think this is about a month that I was there. And, you know, one thing I learned is nurses and doctors are pretty amazing. And it's a rough job. And I also learned that there are quite a few women who go into the hospital before having a baby. It's a very serious business. Anyhow. So it was really interesting. That is how I found out I had Polycythemia Vera. Went through the pregnancy, super rough. We were in, before I was hospitalized, we were constantly getting sonographs and test after test after test. I was at the doctor's office almost every single day without being admitted. Then once I was admitted, I had a bunch of appointments while in the hospital. And from my bed, I was canceling other doctor appointments because I was already in the hospital. So a lot of things. It was really rough. That's how I found out I had Polycythemia Vera. It's something that I learned while I was there. So they also told me, you know, there's a high chance that you will bleed out and you will not survive after having your baby, or your baby won't survive. But they did distinctly, you know, those are both ifs and pretty much in your face. I didn't tell many people when I was pregnant. I mean, I really didn't. I was scared. Number one, I was so scared. It was so personal, and I've always wanted a baby, and I couldn't quite grasp it, and I didn't want to share something like that until everything was okay. I'm going to fast forward a little bit. After all of that, you know, we were there for a long time. Injections. Oh, they ended up putting me on heparin in the hospital, along with aspirin, of course. And then I got, I guess, some steroids, but they're for the baby mainly. And I had the diabetes also, which was kind of crazy. I had preeclampsia. I had all sorts of crazy things. And my baby was born, and he was, oh, this is so bad, like 34 weeks, I think it is, or 35. My husband's the number guy, and honestly, I still have some issues remembering details around that whole time. I was in the middle of there, you know, checking my stomach, and all of a sudden it was a big rush. His heart was slowing. Mine was going extremely fast, and they didn't know which one. They threw us into the room. It was like insanity. And anyway, long story short, it was crazy. It was a huge circus. Lots of care and attention. I have a beautiful baby boy. He was 2.5 pounds when he was born. He was a teeny little guy, and we're so blessed. He's so amazing. And I learned so many lessons from this. Long story short, that's how I learned I had PV. I do have a wonderful, most beautiful, precious, loving, adorable son. An extremely hard, difficult time to have him, and he's worth every second of it. And now I am going on to being a mom with Polycythemia Vera and all the things that, you know, that entail. And I want to share with everyone, you know, the daily life, how it's been. There's a lot more stories, a lot of things. And if I can help anyone else who has an MPN, who has any questions, I would love to. I don't have all the answers by any means, not even close. But, you know, I'm generally, this is totally out of my norm, but I'm generally private about these things. But, you know, people need help. And if someone can be there and they need something to talk about, or if, you know, there's any feedback, anything, just how it is. I'm also trying to do a legacy project for my son. He is now 2 and he's awesome. And this is where I'm finally getting around to it 2 years after he's born. It's a long time, long story. Doing a legacy project. I would like for him to know who I am, what I'm doing. Things aren't always looking the best when you have any problems. I'm not saying I'm dying tomorrow by any means, but I learned a lot in the hospital because they did think that I was going to probably die. It makes you look at life and what matters. And to me, if I live another 30 years and my son is here and it's awesome, and he's 32 years old, and maybe he wants to look at videos of his mom. So, you know, one of those things. Anyway, I hope I've informed you a little bit about PV, pregnancy, life. If you have any questions, let me know. Subscribe to my web page or the channel. I'm new to YouTube, but I want to do something. And I hope this works. I hope it helps. Thanks.